Hi everyone, Premier Kenney here, and I'm doing a Facebook Live question and answer session for the next hour or so. So just write in your questions in the comments below. You know the drill. And if you'd like to, you can share this with other folks if they have questions too, on any subject you might like. Ready to go to questions as soon as you want. Of course, we had the federal budget yesterday, could talk about that or anything. So first question I see is from Weem Elzine. Weem says, why don't we shut down international travelers? Most travelers come and walk out with exempt forms, no test, no quarantine. Well, Weem, the federal government has imposed some pretty stringent restrictions on international travelers arriving back in Canada. They are required, first of all, to show up. They're not admitted unless they have proof of a negative PCR test done within 48 hours of boarding their flight. They have a temperature check before they can board the flight to Canada, and they go through a symptom screening as well. And then they go through all of that again. They have to be tested upon arrival. And if they don't have an adequate proof of a negative test, or they've arrived back in Canada, they have to go into a quarantine situation for, I believe, 48 hours until they get a negative test result back. So there is pretty significant screening. But I would add this, Ween, that we are seeing direct flights coming in from countries with a growing number of what we call variants of concern. Brazil and India would be particular hotspots right now for those variants of concern that can be more contagious. We're very concerned about the Brazilian one because it apparently pierces the protective effect of naturally acquired immunity through prior infection. So I would call upon the federal government to suspend direct flights from those countries. We've seen reports of many people disembarking from direct flights from India to Toronto who've been COVID positive. And while the feds do have a short-term quarantine requirement in a federally leased hotel, these people do go home after that, and it's an honor system that they're to quarantine for the next 2 weeks. And there's always a risk that they don't. And that the virus can spread from there. So I do think that's one gap. And that was the fatal error that Canada made at the very beginning. The countries like Taiwan, Singapore, South Korea, Japan, that have done best through COVID with very, very few cases and very few restrictions, had hard travel. Australia and New Zealand are in this category too, had hard travel restrictions from COVID hotspots internationally from the very beginning. But you may recall in February or March of last year, people in the federal government were implying that it was somehow bigoted or racist to impose travel restrictions. I think that's ridiculous, and it was a huge misstep by Canada from which we must learn. All right, April Ashley says, why can't Alberta open like Texas? Cases are down and life is back to normal. Well, April, I sure wish we could, but it is a totally different situation. And the main answer is vaccines. The U.S. has had about 4 times more vaccinations than we've had in Canada because they have their own domestic vaccine production, and they just ensured that their people got first access to those vaccines. Whereas Ottawa got in the queue and they appeared to have muddled the contracts. So we have been about 40th to 50th in the world in per capita supply of vaccines. Now, we're starting to pick up, but we basically lost 3 months while the U.S. was at our current level of vaccination in January, February, and March. We didn't really start to hit that until the end of March and into April. The second main factor is much higher levels of natural infection. So most experts have estimated that Texas, for example, had about 32% natural immunity through prior infection by the end of February. And at that point, at the end of February, they also had about 15% immunized. So 32% plus 15% means that they were at about 47%, half of their population had protection from COVID, interrupting the chain of transmission. And now I think they're probably up to, I'd have to check my numbers, but I think they're up to about 75% with vaccines or prior infection. Whereas in Alberta, we've had a much lower level of infections throughout COVID, which I think is a good thing. That has saved a lot of lives. And in fact, right now we estimate that about 10% of Albertans, probably about 450,000 people, have some degree of protection through antibodies from having gotten the virus in the past. So that's 10% versus Texas at about 1/3 of the population. And right now we're at about, I think 19% of the population that's been vaccinated. So we're getting up there, and I actually do think we're starting to see some early signs of the effect of vaccinations in at least potentially limiting hospitalizations. But we're not there yet. And the other thing is, when Texas made that decision to open up about a month ago, their numbers were coming down drastically because of the vaccines and the antibodies. Our numbers continue to climb up, and we are close to hitting 20,000 active cases. So our numbers are going in the wrong direction. Theirs are going in the right direction. I think there are some other factors. By the way, one point I have to make. You might say, well, Texas did the right thing by letting the virus run more freely, and that infected 1/3 of their population, which meant higher antibodies. True. But they did it at a great cost. Their per capita COVID death rate in Texas and many similar states is about 4 to 5 times higher than in Alberta. And in fact, I'd ask my team here to please look up the Texas death rate per million. In Alberta, it's 460, and I believe in Texas, it's around 2,000. So per million. Translate that into Alberta terms. Imagine Alberta having had 10,000 or so COVID deaths rather than the 2,000 that we have suffered to date. I don't think that would be morally acceptable, and I believe the vast majority of Albertans would agree with me on that. And then finally, one thing playing in Texas's favor is weather. We're finally starting to get some spring weather here, but warm weather means people can go outdoors more, where transmission is very unlikely. All right, Remington Abernathy Jr. says, when will the applications open for SMERG number 3? For those folks that don't know, that's the Small and Medium-Sized Enterprise Relaunch Grant. And the applications will be opening very soon, Remington. That's a up to $10,000 grant on top of 2 tranches of $10,000. So altogether $30,000 potentially available to small and medium-sized businesses who have suffered a revenue loss of 30% or more since last March. And so I believe those applications will be opening later this week or at the latest early next week. Jackie Larkham asks, are you concerned at all that AstraZeneca and Johnson & Johnson have been pulled out of other countries? Well, Jackie, I follow the scientific advice that we get. Canada has a National Advisory Committee on Immunization, and Alberta has our own Scientific Advisory Committee, both of whom have strongly recommended AstraZeneca and Johnson & Johnson for use within certain age parameters. And as well, Health Canada has approved both vaccines for use in this country. So the main concern that people are expressing about the AstraZeneca is that there have been a very small number of blood clot cases associated with it. Now, the last data I saw, now admittedly this is about 2 days ago, had 700,000 doses of AstraZeneca vaccines having been administered in Canada, and 2 cases of blood clots. Now, I think that may have gone up by 1 or 2. But basically, the range of risk for blood clots associated with the AstraZeneca vaccine is something in the range of 1 in 200,000. Now, by comparison, 1 in 4 people who end up in hospital with COVID-19 end up with blood clots. So you are much, much more likely to get a blood clot if you get COVID, and much more likely to have other negative health outcomes, including death. We have seen no deaths that I know of associated, certainly not in Canada, with vaccines. We do keep track of what so-called adverse events associated with the vaccines, and the number is quite tiny. In fact, we've administered now 1.2 million doses of vaccines as of last night, and we have registered 234 adverse events. So these are safe vaccines, and the risk of COVID is far higher, which is why I'm comfortable with the scientific advice that we have received and the medical advice that we've received to support them as part of our vaccine program. I myself will be receiving the AstraZeneca vaccine tomorrow. I made an appointment online on Tuesday. All right, Nikki Flack says, when are you going to shut us down? When are you going to put all schools online? Schools are not safe. Well, Nikki, Alberta's not going to shut society down. The damage to people, including their mental and emotional and physical health, would be far too costly. Our approach, our goal, to be clear, Nikki, has been to control viral spread so that we can avoid large numbers of preventable deaths and prevent the health system from being overwhelmed, while minimizing the damage of restrictions on our broader social and economic health. So there's that balance that we have sought, and I think done a pretty good job in Alberta. We have had a lower per capita COVID fatality rate than Canada as a country, than other large provinces, than all 50 US states, and lower than I think all but 2 European countries. And yet we've done that with much more targeted and limited public health restrictions than most of those jurisdictions. And so I think we found something like the right balance in this province. And with respect to schools, Nikki, the schools are safe. In fact, we have about 720,000 students in classes in 2,500 schools across the province. And let me just share this with you. We have so far identified, I think it's 1,300 confirmed cases of in-school transmission. So that is 0.25%. 0.25% of students have been affected by in-school transmission. Put it another way, 99.75% of students have not acquired COVID-19 in school. And I know you don't hear that much. There's a lot of hysteria being promoted, unfortunately, by the NDP and by some special interest groups. But it's important to keep that in perspective. A second point is that kids are not negatively affected. Their health is not affected with the exception of a statistically insignificant number of cases. The health of children is not threatened by COVID-19. In fact, the scientific data is clear that children suffer more adverse health outcomes from the regular flu than they do from COVID-19. And younger children are much less likely to transmit the disease as well. To the extent, most of the transmission or most of the cases identified in schools have come from community transmission, from kids picking it up from at home, for example. And when it comes to teenagers, well, we have gone to online instruction in Calgary, Edmonton, Lethbridge, and Fort McMurray at the request of those school boards for 2 weeks for grades 7 through 12. That's primarily because of self-isolation requirements meant there was a shortage of supply teachers. But this will also help to perhaps reduce somewhat transmission. Although with teenagers, you could close the schools, and teenagers, I think, are still, a lot of them are going to get together and socialize. We saw one high school in Calgary that had to suspend for in-classroom instruction for a while. And apparently it was because a bunch of the students held some house parties, and that's where the transmission occurred. So finally, and I think there is a very strong consensus amongst experts, both educational and public health experts, that suspending the schools from in-classroom instruction is the last measure that we should take, because the cost of that is so high. There's a growing number of studies demonstrating that the interruption of in-classroom instruction has set students back enormously in their education and in their development. And this setback has been especially hard for kids in disadvantaged families, families that may not be able to afford laptops and web service. And so we think the worst thing we could do for those kids especially would be indiscriminately to shut down the schools. Why? For a virus that does not really threaten the health of children, and where there has 99.97% of kids have been unaffected by in-school transmission. All right, Chantal Beaver says, what's your take on the federal plan for childcare as it relates to Alberta's large shift working population? That is a great question, Chantal. Thank you for asking that, because as far as I can tell so far, I mean, we're going to have to study the details, but it looks like what the feds are saying is that they are offering to cost share a portion of the cost of what I would call institutional daycare, which is like 9 to 5, and they say they're going to exclude those that are businesses, so only basically union-run nonprofit or government daycare centers, which are typically urban, and as I say, 9 to 5. That does nothing to help shift workers, for nurses and oil field workers and other and emergency workers who work in different hours. Who it doesn't help their kids, and if they're away, let's say a working mom or a working dad who's up in the oil field for 2 or 3 weeks, that they need different childcare arrangements than a sort of 8 to 3 or a 9 to 4. Urban daycare center. It doesn't address the needs of rural parents, and it doesn't address the needs of the vast majority of parents, about 6 out of 7 families, who do not use that kind of 8 to 3 institutional childcare, who use all kinds of different approaches, who might use day homes or relatives or friends to take care of kids, or parents who will give up a second income to spend time with their younger children at home. I don't think it's fair to tax them to subsidize the arrangements that other folks have made. So our view is that any childcare support should be universal, it should be flexible, and it should meet the priorities and lifestyle of all families, not just a relatively small group of families. So that's what we'll be fighting for if we talk to the federal government about that. Catherine Filipowski says, I'm concerned about Bill tongue-tied here. Bill C-66. It seems to still say that forced immunization can happen. Please address this. No, actually, if I could ask one of my team here to run up to my office and grab Bill C-66 off my desk and find the immunization section, and I'm going to come back to Catherine to quote her, but from chapter and verse from Bill C-66. So for those of you who don't know, we committed as a government to remove from the Public Health Act the power of the government to mandate, to force people to be vaccinated. That power has been in Alberta's law since 1910, since the Public Health Act first came in. So far as we know, it's never actually been used, but we got a lot of questions about whether we were going to have mandatory vaccination. I wanted to be so clear about that we actually wanted to amend the law to remove the power of mandatory vaccination. And that's what Bill C-66 does. Very clearly, it follows upon the recommendations of a legislature committee that studied the issue. And Catherine, I'll come back to you in a minute when I get the actual bill in front of me. All right, Nathan Billock says, can you comment on the federal Conservatives' carbon tax? Feels like a stab in the back to the Western provinces, and the tax burden is already high enough. Aaron O'Toole should join the Liberals if he wants a carbon tax. Well, Nathan, you're right. The federal Conservatives did introduce a wider climate, environmental, carbon emissions policy last Thursday. And what Mr. O'Toole has said to me is that they're going to respect maximum flexibility for the provinces. And they have this carbon savings account idea that would, I think, be capped at, what is it, $40 or $50 per ton, as opposed to the Liberal carbon tax that goes to $170 a ton. Yeah, thank you very much. And so that is I think one aspect of this that there's, look, I haven't had a chance to study their plan in detail. I think it is a far sight better than anything the Trudeau government has proposed. For example, the federal Conservative plan argues for Canada to get carbon credit for our LNG exports to China to help them stop burning coal. That's a critical issue. For example, they show strong support in there for carbon capture, utilization, and storage, which is one way that we can reduce emissions. All I can tell you is this. This Alberta government repealed the NDP carbon tax. We sued the federal government over their carbon tax. We won at the appeal court, lost on a 6-3 vote, split decision at the Supreme Court of Canada. Now we're going to consult with Albertans on our best next steps. One thing I guarantee you, we will never use this as a tax grab, and we will choose the policy that imposes the least possible cost on Albertans, because I fundamentally disagree that punishing people for driving to work and heating their homes is a responsible environmental policy. All right, next question goes to Karn Kang, and he says, Premier Kenney, I know you've mentioned festivals such as Stampede can possibly happen this summer. Does that include music festivals also? So Karn, in principle, yes. We haven't made the final decisions, but the major festivals and summer events, many of them are part of a consultation group with Dr. Hinshaw and our public health team, and they are walking through how best to design protocols for safe outdoor events. I am confident that we can have outdoor events within certain parameters this summer, and as I say, public health is still identifying those, and whether it's music or not, I think there's safe ways of doing that. So I'll go now to, if I should actually ask our team here just to find the section on vaccines, I'd appreciate that, because otherwise I'll be reading that legislation all night. All right, we'll go to the next question. Please bring up the next one. Well, there must be more questions here. All right, Sandy Long Sears, are you concerned at all that Justin Trudeau is using the premiers of each province as scapegoats in this vaccine debacle? Well, Sandy, I'm not happy. Sorry, we're just looking for the vaccine section of that, please. So, Sandy, I'm not happy with the Prime Minister taking the odd pot shot at the provinces on this. The federal government had full and exclusive responsibility for the vaccine procurement. Clearly, no argument. And so, yeah, if you guys just find the page, just show it to me, please. So the federal government was supposed to do this. They, in fact, made it impossible for provinces to procure the vaccines internationally. And so we had no alternatives ourselves. The federal government in the early 90s, about in the mid-90s, pardon me, drove the brand name manufacturers out of product development here in Canada because they changed the patent laws, so we had no domestic production. And so Canada, long story short, muddled up the procurement. Israel is at 90% of their population being vaccinated. You know, we're pushing 20% now. The United States is over half their population vaccinated. And the provinces have absolutely nothing to do with this. So we're rolling out the vaccines in terms of the administration as quickly as we can. And I just think that, you know, all I can tell you is this. If we had this access to the same supply of vaccines in January, February, and March, we would not be in this pickle right now. We could be opening much more, like many of the U.S. states. All right, Andrea Bro says they are not our questions that you're answering. They are scripted. I just asked your question, Andrea. They're real questions, and you can actually go down and identify. You can see every one of these questions I'm answering. We're just trying to pick a representative group of the questions. And please don't be angry with other people, Andrea, if not everybody agrees with you. We're trying to be representative. Okay, we'll go to Woods Lee, says, why did you keep vaccines in freezers instead of distributing? We haven't, Woods. In fact, see if I can find the exact numbers for you here. But the main holdup in terms of distribution has been because of a lack of demand on the AstraZeneca. And you know, there's been a lot of negative media coverage and a degree of confusion about the AstraZeneca, about who qualifies, about their safety. We believe they are safe. I'm taking it tomorrow. But as a result, a lot of appointments for the AstraZeneca, like tens of thousands of appointments, were canceled. People just didn't show up. And so one of the reasons why this week we lowered the minimum eligible age for AstraZeneca to from 55 to 40 was to expand the eligible population to solve that demand problem. And now I'm happy to say that the AstraZeneca doses are flying off the shelf. So yes, we did have about 160, 180,000 doses of AstraZeneca in the freezer this past weekend. Again, because people we didn't have the kind of uptake that we wanted or needed. But I can just tell you that overall, we have received 1.4 million doses of all kinds of vaccines. And as of last night, we'd administered 1.2 million of those. We have 200,000 in inventory. But when I say inventory, many of those have been sent out to pharmacies and the actual vaccine distribution centers, because we obviously can't administer them the moment they arrive. There is a supply chain getting them out there. And this means that about 85% of the vaccines that we've received have been administered. In the case of Pfizer, it's 100%. In the case of Moderna, it's 69%. In the case of AstraZeneca, the percentage of doses received that have been administered is only 23%. So that's the problem, is that people not enough people who were in the eligible age group were coming forward for the AstraZeneca. But I think we've solved that now. Okay, Corey Orrit says, what are you going to do about big tech censorship and the federal government censoring the Canadian internet? That's a very good question. You know, Corey, I don't think there's a lot that the provincial government can do. Although I noticed that the governor of Florida, Ron DeSantis, brought in a recent executive order on this issue that I intend to take a closer look at to see if there might be anything within provincial jurisdiction. But I did read a story just today or yesterday that really concerned me about a proposed new federal bill, if I'm not mistaken, that would allow some kind of federal authority to determine if something posted online is accurate and to have the power to take it down. Now, I hope that article I read is accurate. I assume this is what you're referring to. I mean, if that's the case, that wouldn't stand hold up in it for a day in court. That would be a flagrant, obvious violation of freedom of expression. And so I, at least politically, morally, and personally, would support any challenge to that kind of a law. All right, Pat Andrusiak says, Kenney, are you handing out vaccine passports? And are you restricting those that don't take a vaccine? The answer, Pat, is no and no. I've been very clear, no vaccine passports in Alberta. And in fact, I believe it's against the law for the government of Alberta to provide that kind of information to employers or businesses as to whether or not somebody's been vaccinated. That, as far as we are concerned, is private health information protected by the Privacy Act. We are removing the power of government to mandate that people take the vaccines. There will be no vaccine passports in Alberta, period, full stop. All right, next question goes to Joanne Pay. How is the 21-state KXL legal action against Biden going? Is TC Energy going to sue under NAFTA, and will Alberta join them? So, Joanne, the answer is I think those states are still bringing together their legal strategy. They've announced their intention. They have not yet filed. And with respect to TC Energy and the government of Alberta, under the investor protection provision of NAFTA Chapter 11, we have, within 6 months of the presidential veto, which was on January the 19th, I believe, we have within 6 months, so into July is our deadline to make that filing, and we are working with our U.S. lawyers and with TC Energy on that. All right, Sa Za says, how do you respond to 18 members of the UCP going against your orders? I thought you guys were united. Well, first of all, Saza, I don't make orders. The government has policy, and I stand by that policy. The policy is to protect lives and protect our healthcare system from being overwhelmed. If you see what's happening in Ontario right now, you can see if COVID goes out of control, it truly can overwhelm the hospital system. And so but at the same time, this is a democracy. It's more specifically a representative parliamentary democracy. And I respect the right and the responsibility of elected members to either reflect the views of constituents or if they have strongly held views, their own views. I always ask them to do it responsibly and prudently. For example, I've been clear that it would not be acceptable to me if a member of the government caucus were to counsel people purposefully to engage in civil disobedience, to undermine the rule of law, which is a core principle of our society. But I've said from the very beginning that I respect that there should be a range of opinions and a lively debate on the best response to the pandemic. As Dr. Hinshaw has said, there is no one way through the pandemic. And as I've said, there's no easy way through it either. There are very difficult trade-offs. And I can tell you that in our government UCP caucus meetings, we have very vigorous discussion and debate about this all the time. But at the end of the day, the government is responsible for making decisions based on all kinds of input, general public input from MLAs, including the government caucus, obviously very important input from our public health experts, our chief medical officer, and so many other sources of input. And we have to make the tough decisions. And I guess I say to anybody who disagrees with those decisions, put yourselves in our shoes. And what decisions would you make? Would you take the risk of allowing COVID to run wild, of allowing cases to grow, to double every couple of weeks? What is your risk tolerance for the number of deaths in Alberta? Do you think would be acceptable? I'm just saying to people generally, do you think it would be acceptable to have like 10,000 COVID deaths in Alberta, which is the equivalent of where many US states are at? Do you think it would be acceptable to completely lock down society, as many advocate, which is I believe the policy of the NDP? So for every one of those choices, there are negative consequences. We have to balance all of these things, and one of the things that we take into account are the views of elected MLAs. I don't understand why that's controversial. It shouldn't be. So I guess folks like you are attacking me for tolerating a range of opinions. I call that democracy. All right, next question goes, for folks looking for that, maybe the health department could help you find this section. So Lindsay Walker says, I'm finding that a lot of people, especially in our rural areas, are refusing to take precautions. They've stopped wearing masks and keep distancing. What can be done? What are businesses' legal abilities? Well, Lindsay, thank you for that question. And I understand people being sick and tired of this. I understand what it's called COVID fatigue. I'm tired of it too. But I get that a lot of people kind of let their guard down. But folks, that we are at the highest point of COVID cases that we've experienced in the province. We are leading the country in daily new cases. Right now, we're approaching 20,000 active cases. And over the past couple of months, about 5% of active cases end up 2 weeks later in hospital. So simple math, based on those percentages, we could expect in a couple of weeks, 2 weeks' time, to see upwards of 5% of 20,000. We could expect to see 1,000 people in hospital, and if the numbers double from there, 2,000 people, and then we're capping out the maximum of our healthcare system. Now, the good news is the vaccines are coming in. They're hopefully catching up to the variants. But this is serious. It is real. And I would just ask people, it's really the next month that we need to get through. Because I believe that don't hold me to this date exactly, but by roughly the end of May, the vaccines will have such wide effect that COVID will start hitting the wall of vaccinated people. But we're not there yet. Now, what can businesses do? Frankly, not very much. We don't impose the responsibility on businesses of enforcement. That is a responsibility of the enforcement agencies. But if somebody's really being a jerk about it, I don't know. If I was running a business and somebody walks in and is just flagrantly breaking all the rules and trying to get the business into trouble, I might, I don't know, ask them to leave or call the appropriate enforcement authorities, because it's not the business's fault. All right, Andy Thiesenhausen says, how are you going to pay back the 15 or 20,000 per capita deficit accumulated over this year? So, Andy, if you mean the province's deficit, I mean, obviously the federal deficit is way larger. The answer is we can't pay it back until we've eliminated the deficit. So we have to take, this year, because of the COVID crisis, an $18 billion deficit. And we have outlined a plan to get that down over the next couple of years to about a $8 billion deficit. That's through economic growth and cost control by finding greater efficiencies. And then it's going to take a couple of years after that to be able to get back to balance. But it's going to require ongoing two things: economic growth that will increase our revenues, and it will result in more jobs and more people paying taxes. And the other part is so economic growth and spending restraint. We have to get our spending down, at least to the average amongst other Canadian provinces. All right, Vanessa Landry says, hello, Mr. Kenney. When will everyone be able to get vaccinated? People under 40. So Vanessa, people under 40 in the general population would be in our what we call phase C of the vaccination program. And I don't have an exact date, but first of all, we have to have vaccinated, as many people as we can in groups A and B. And that's basically the seniors, frontline healthcare workers and some other frontline workers, emergency workers, and people with serious health conditions that are, and by the way, the people with serious health conditions in group 2B, they could be 16 years of age or older. So if you're a 20-year-old and you have severe asthma or serious renal disease, you can qualify right now for the vaccine. So sometimes I'm asked about teachers. Well, teachers who have medical conditions, regardless of their age, are eligible. And if they're 40 or above, they can get the AstraZeneca. But I do hope that we will be able to open up to the broader population in what we call phase or group C in the month of May. But it's all dependent on vaccine supply, which is kind of out of our hands. We keep getting delays and cancellations from one supplier in particular. But if we can get more supply, particularly if other ones come on board, like Johnson & Johnson, I believe that we'll be able to get to the under 40 population certainly sometime in May. All right, Amanda Francis says, can you do something about the outrageous distribution fees on gas and electricity? Sure, Amanda. Thank you for the question. On gas, that's why we eliminated the Alberta NDP carbon tax. And on electricity, our Associate Minister for Electricity, Dale Nally, is actually digging into that. The problem is it's a legacy cost from the past. There was a huge expansion of Alberta's transmission network about 10 and 12 years ago. And the costs of that are embedded in the price of power. They're amortized over a certain period of time. And this is a regulated price. So it's incredibly challenging. I mean, the only way that the government could step in would be to tax you to then subsidize your transmission rates. And that doesn't make any sense. Stepping in with subsidies just to hide the transmission costs when you would have to pay for it through your taxes anyway. So we're seeing if there are some other solutions, working with the AESO, which is the regulator of power prices, and with the power companies. All right, Jason Ladouceur says, how come all the health professionals that oppose this scandemic are censored and silenced. Jason, I don't believe that they're censored and silenced. I think one answer is there are very few health professionals who believe that this is a scamdemic, that this is some kind of a conspiracy. I'm aware of 2 doctors in Alberta, both of them retired, who had a news conference last week. They claim, like you do, that it's a scandemic. But then there are thousands of doctors that know that this is very, very real. If you want to talk to doctors who are willing to, I guess the best person to respond to that would be a doctor working in an ICU unit, losing patients every day to this disease. Again, people are, nobody's being censored. Rick Holman says, I've missed it earlier as I'm joining late, but why are we allowing BC residents into Alberta if they're not allowing Albertans into BC? Well, Rick, the BC government, they're not setting up checkpoints on the border. They said they're going to have spot checks. They're not imposing, I don't believe, fines or penalties on Albertans who happen to be in BC. If you're an Albertan and you have a second home in BC, for example, and you have a legitimate reason for being there, I'm sure you can explain that. They're trying to discourage unnecessary travel. And quite frankly, I don't believe in barriers within this country, which is why we've not imposed a similar policy. But frankly, I'd like to see less travel from BC to Alberta as well. As far as we can tell, all of the P1 variant cases, this is the Brazilian variant, in Alberta came from folks traveling back from BC. You may recall BC literally shut down Whistler because the P1 Brazilian variant was going crazy there. And it looks to us like some of the people, after the party was shut down Whistler, some people brought the party to Banff. Like quite literally, skiers, young people who left Whistler came to Banff, and now we have the P1 present in the Bow Valley corridor. So that's why we're all concerned about travel and just encourage people to avoid non-essential travel for the time being so that we can beat COVID with the vaccines and have wide open travel this summer. So let's look forward towards the summer. All right, Terry Marie says, Kenney, why did you refuse to send help to Ontario? Well, Terry, we did send help to Ontario in the form of airplane loads of personal protective equipment, and I believe we also sent them 100 ventilators about a year ago when they were within days of running out of ventilators and PPE. So we had stockpiled a huge amount, we had surpluses, and we shared that with Ontario, with Quebec, and Nova Scotia at the time. When Premier Ford asked if we could encourage any Alberta medical practitioners to go down to help in Ontario hospitals, I did pursue that line of inquiry through our Health Minister, Tyler Shandro, and through the Department of Health, AHS, to see if that was at all feasible. And the advice I got back was, no, it's not, because of the pressure in our healthcare system currently due to COVID. And we do expect, like right now, we have about 500 patients with COVID in our hospitals, about 100 of whom are in intensive care. And we can manage. Our great professional frontline staff are coping with that. Thank God for them. We thank them for it. But we fully expect that with the current number of active cases, that the pressure will probably double and will probably be up between 800 and 1,000 COVID patients in hospital 2 to 3 weeks from now, and probably 200, give or take, 180 to say 200 in ICU. And that pressure then becomes very intense. And we don't want to catch ourselves flat-footed with the doctors and nurses that we need in another province. But we wish our friends in Ontario well, and because they have virtually no COVID in the Atlantic provinces, I think they're in a better position to share in terms of their workforce. And so that's what I've encouraged Doug Ford to look at. Nicole Alicia says, when are restaurants going back up? Well, restaurants are up. They are operating. They have, of course, takeout service, but also patio service. And as the weather gets better, they'll be able to continue more business there. In terms of in-dining service, look, in terms of the current restrictions, we will not be able to relax them until we start to see the numbers come down. And until we know that the vaccines are beating the variant, I hope we'll start to see that towards the end of May. All right, Steve Kalinchuk says, is Alberta still planning to move forward with appointing their CFO? Yes, that's the Chief Firearms Officer, and the Department of Justice and Solicitor General is leading the final selection of the Alberta CFO. And by the way, I should point out that Michaela Glasgow's Bill 211 passed the legislature, and I believe it's being signed into law by the Lieutenant Governor tomorrow morning, and it removes the power from Alberta municipalities to impose gun bans, which the federal Liberal government tried to give those municipalities. So we're not going to allow municipal governments to step in and seize law-abiding firearms owners' guns. All right, Charlene Crookshank Fraser says, are the schools going back online considering the high numbers? Well, as a general answer, no, Charlene, but in some school districts where they've been unable to properly staff the classrooms because of isolation requirements, in those jurisdictions, we have worked with them to allow for a 2-week period of online learning for grades 7 to 12, but grades K to 6 are not affected. So it's 7 to 12 right now on a 2-week online learning interval in Lethbridge, Calgary, Edmonton, and Fort McMurray for both the public and Roman Catholic separate school boards. Let me add that high school kids are, I think, much more capable to do online learning than the younger kids who lose a lot more when they're not benefiting from in-classroom instruction. Also, younger children are less likely to transmit and much less likely to become sick from COVID than older children. So, focusing on the high schools, I think, makes sense where there is a need on a local basis. And just one second, folks. All right, James Gibson says, what investment has been made to increase capacity for COVID patients? So a lot of investment. In fact, I think it was $3 billion additional dollars spent in the healthcare system last year to provide all the resources they need for COVID. I was very clear with the health ministry from day one that there would be no resources spared to cope with COVID. And in the budget that we just passed in the ledge, we've added an additional contingency of $1.2 billion for COVID-related health costs. Now, I'll remind you, we don't expect COVID, thank God, to carry on all year, so most of that will be spent in the first 2 quarters of this fiscal year. And on top of that, there's also a $1 billion increase in the baseline budget for health to deal with things like reducing surgical wait times. So I get, maybe, James, implicit in your question is the question of, a lot of people say, well, why do you have restrictions instead of expanding the healthcare capacity to deal with more cases? And the answer is, we have expanded healthcare capacity. I'll give you an example. On a typical day, in a non-COVID year, we might have about 250 or 240 staffed intensive care beds in Alberta's roughly 100 hospitals. And usually those beds are operating province-wide at about 80% functional capacity. So there's a bit of margin for surges, emergencies, etc. We have brought that up so that we can accommodate about 425. So we've nearly doubled the number of ICU beds that are available for COVID. Now, but the problem is we can't increase that capacity infinitely, because ultimately it's based on the number of people with relevant skills and certification in particular medical trades, particularly ICU nurses, anesthesiologists, respiratory therapists, and people like that. And there's only a finite number of them. You can't just snap your fingers and produce more anesthesiologists or respiratory therapists in a short amount of time. We've done what we can to recruit back retired folks, to incent people to work longer hours through overtime. That's been very costly. To accelerate the certification of graduates from medical school and nursing school, as well as respiratory therapists. So we've done everything we can to increase our workforce capacity, but ultimately there's a finite quantity because there's just a finite number of people with the relevant training. All right, if I could get the actual bill, I'd appreciate that. So somebody had asked if we could put up another question here in the meantime. I'd appreciate that. So let me see, what else? You were asking, I guess, the last question was about health capacities. I say we've increased the funding. Okay, here we go. Scott Diehard Kucherawi says, first, thank you for your leadership during this difficult time. My question is, do you believe more restrictions will be coming in the weeks ahead? I sure hope not, Scott. I sure hope not. All I can tell you is this. We don't control COVID. We don't tell it how fast it's going to grow. We don't know how many of these more contagious variants of the disease are coming at us. We're just trying to keep it under control until the vaccines can catch up. And to be honest with you, Scott, where we sit right now today, looking at all the numbers, which I study every day, I believe we're there. I believe that we if we just stick to our knitting, and if people are careful, and we avoid an acceleration of the rate of growth, I believe that in May the vaccines will catch up to the variants. But we have to keep our options open, because if a growth accelerates and we're back into like very fast exponential growth, then we know what's coming at us in our hospitals. So that's the best I can share with you. All right. I'm having challenges here with this. So we're just going to post the answer to that question about Bill C-66 online, because I need to look at the old statute and this one. Mikhail Casta says, open up Alberta, don't listen to Klaus Schwab. Well, Mr. and Mrs. Casta, I don't listen to Klaus Schwab. Klaus Schwab, for those who don't know, is the president of the World Economic Forum, also known as the Davos Summit. And I have never met with or spoken to Klaus Schwab. Quite frankly, I'm a major critic of his. I think his book, which is called The Great Reset, is grossly insulting to people. This notion of taking the pandemic as an excuse to advance left-wing politics. And so I have, frankly, very little regard for Mr. Schwab. And he did not tell Alberta to impose health restrictions. We have done this in our own Alberta way to protect lives. And I would say to Mihail, what is your alternative? If we had no public health measures in this province, and we had the same kind of viral spread, let's take Arizona. A friend of mine called me mockingly the other day, said, we're back to normal down here. We have no restrictions. Well, yeah, it's because they have vaccines, and they also had a high level of natural immunity through prior infection at about a third of their population. But guess what? Arizona had 5 times more deaths than Alberta per capita. 5 times more deaths, even though they did have some restrictions. Mikhail, if you were in my position, would you accept policies that could have resulted in 10,000 Alberta COVID deaths rather than 2,000? My view is that would be immoral and grossly irresponsible. Right now in Ontario, their hospitals are overwhelmed. they may have to begin triaging patients in ICU. So, Michael, that's not a conspiracy theory, or that's not a conspiracy invented by Klaus Schwab. That is a reality in the hospitals. And if you don't believe me, just watch the media reports of ICU nurses and emergency doctors reporting what they are seeing and doing and encountering every single day. Do you think they invented this because some Swiss socialist told them to? Like, where do you guys get, folks like you, Mihail, come up with this stuff? What would you say to me if we were in a situation, we just let it run wild, and we went from, let's say, 100 to 400 in ICU, and we were running out of capacity? And what if I'm sitting here and AHS comes to me and says, Premier, we no longer have any functional capacity for staffed ICU beds. We've run out. We are now going to have to choose who we do not treat. Here are your options. We can deny care to people based on age, based on their body mass index, based on the presence of other chronic conditions. Who do you suggest we deny care to? So, Mihail, it's all well and good for guys like you to sit there in your conspiracy theory sandbox, imagining that some socialist in Switzerland has invented this. But you don't have to sit there and potentially have to make decisions like that, like doctors may have to do any day now in Ontario. And I, for one, will not allow us to be put in that position in Alberta. Period. Full stop. But at the same time, we are doing everything we can to take a targeted, measured, and limited approach to public health restrictions designed to limit spread and protect lives in our healthcare system. There's a good article by Lauren Gunter comparing our approach to that of other provinces in today's Edmonton Sun. Look it up to see the difference that our targeted approach has taken. I get criticized for that every day, undoubtedly by people on Facebook right now. We had a questioner earlier saying, why haven't I completely shut down the schools? The answer is because that would have a damaging and lifetime effect on the development of those kids, especially from disadvantaged families. I get hounded by the NDP every day for allowing the schools to operate. 720,000 students and teachers and staff coming together for in-classroom instruction. And does that risk accelerating transmission? Yes. I don't think by a great deal, but it's a risk we're taking. We've taken a risk-based approach in Alberta. So I just invite those of you who've got your heads into some kind of conspiracy theory, please come back to reality and look at these hard decisions that we have to make to protect both lives and livelihoods. All right, I'm sorry for getting passionate about that, but I really have very little time for that kind of nonsense. Adele Annette Mattern says, how safe is it at the convention center when people are herded like cattle through mazes and they can actually reach the immunization? It took 2.5 hours to get through. Okay, Adele, I guess you were probably a walk-in, and most people are coming with appointments so they know when exactly to show up and get through the queue quickly. And I'm sorry that you had to wait for that time, but we're just trying to get as many people vaccinated as quickly as possible to use as much of the inventory of doses that we have, and that's why we've opened up some of these centers for walk-in. Now, Adele, as you'll know, anybody who goes there is informed either in advance through the appointment. I mean, I got it by text today, or with signage that you're not to enter the convention center if you have exhibited any symptoms, if you recently arrived from abroad, if you're the close contact of anybody who is positive for COVID-19. So there's a symptom screening right away. Then you know when you arrive, you have to sanitize your hands and put on a clean mask provided by Alberta Health. And then you know that you are instructed very clearly to maintain physical distance, 2 meters apart from everybody inside an enormous hall that is well ventilated. So our health experts validate that as a safe situation, and so you can rest assured that every precaution is being taken to prevent transmission in that context. All right, Courtney Hennebury says, could we ever achieve herd immunity, or does everyone need a vaccine? Courtney, the answer is that no, not everybody. You don't need 100% to achieve so-called herd immunity. I find that term a little impersonal, so I call it community immunity. But most of the scientists or the epidemiologists estimate that you reach effectively herd immunity at 70 to 80% with some protection. Now, that's either through vaccines or the presence of antibodies acquired through prior infection. So in Alberta, we figure that we're at about 10% with the antibodies from prior infection, and we're at about 20% of population that have received the vaccine, and about 25% of the population of people over 16. So we're starting to get there. But here's a key thing. Just want to make sure my numbers are correct. Yeah, that's about right. So here's the key thing. We have made and we've been attacked by this, we made a very deliberate point in the first phases of vaccination to focus on the most vulnerable, obviously long-term care residents, the very elderly, and then senior citizens generally, frontline healthcare workers, and people with serious chronic health conditions. And because of that, the people most likely to be hospitalized because of this virus have largely been protected. And so what we hope to see, knock on wood, is a gradual and steady decline in the ratio of total cases to hospitalizations. That's a number I follow every day. Because if we can keep people out of the hospitals, then that's really 3/4 of the battle, right there. And so I don't believe we need to get to 80% immunity in the population to open things up. I've laid out a general path which shows a way between now and basically Canada Day, as that immunity grows, but as it especially the protection of it, especially for those who are most vulnerable. All right, Darcy Ann Plouffe says, answer me this, is there still going to be equalization payments? Quebec needs to stop getting our money. Darcy, equalization is not a voluntary thing. We don't send anybody a check for that. It comes out of the federal taxes that you and I and all Albertans pay. We will be holding a referendum on equalization this fall in October. That doesn't mean it will end equalization, but it will force the federal government to negotiate with us, and it will increase our leverage to fight for a fair deal in the Canadian Federation. Dave Oakes says, are restrictions going to hinder us again next winter or when the majority are vaccinated and this is behind us for good? So, Dave, I would say that I really don't believe there will be the need for significant restrictions much after Canada Day. There will have to be some in the third quarter of this year as we continue to build up more and more immunity. But I think once we get into the fourth quarter, and we have to move on with our lives. And you will hear this, and you'll hear it from some of the media. I predict you'll hear it from some of the NDP who love the lockdown ideas. There will be some saying, as long as there's any circulation of this virus, we can't live with it. Listen, we live with the circulation of a lot of viruses, but we like on the flu, not to confuse COVID with the flu, but as an analogy, we have a vaccine program for the flu, and we learn to control it. It's not as deadly as COVID, obviously. I really believe that once we've reached that point, we estimate about 80% of Albertans inoculated, probably by that point 15% or more who also have natural antibodies. There may have to be booster shots in the future. There may have to be annual vaccines. We don't yet know that. We're waiting for the science to come back on that. But I really cannot imagine a situation where there have to be significant restrictions beyond the third quarter of this year. All right. You know what? I think I'm going to wrap up. We've been at this for over an hour, and I've taken like 28 questions, 30 questions so far. I'm sorry I couldn't unpack the Bill 66, but we will put up on the screen the provision that clearly repeals the power of mandatory inoculation that was asked, I think, by Christine early on in the session tonight. Thank you, folks, for your good questions. Of course, I can't get to the hundreds of questions that are posted below. We did try to choose a good cross-section. And just want to say, you know, thank you for your resilience and your patience. As I know everybody's tired of this, but we are on the 10-yard line. Look, we've inoculated, like we've administered nearly 1.25 million doses of vaccine. We're starting to get some decent supply. I wish we had more. The vaccines are going to catch up to the variants, I hope, over the next few weeks. I'm confident over the next few weeks. And so please just hang in there. Stay safe. God bless. Thank you very much.